Okay, so not a lot new this week, and I think that's a good thing. Um, but let's just kind of talk. As I've been watching the news and reading things, it's more and more about the sort of back and forth between working from home, working hybrid, going back to the office. So I just saw, and I tend to follow the big employers to see what they're doing because it helps the smaller employers decide what they're going to do. American Express just announced starting in March, they want their New York employees to be coming to the office at least once a week. BNY Mellon made a similar, um, uh, issued a similar memo to its employees wanting them to return to the office in March. So what are you thinking about? And I know there are plenty of workplaces that were kind of back or sort of back until the November, December timeframe when Omicron hit. So what are you really thinking about? And so I was talking to a member last week and they said, I've always heard you say that's the employer's duty to provide a safe workplace. I've heard you say that 100 times. So yeah, you guys know that under OSHA, that's your duty. But what do you need to do? You know, we're in such an interesting spot here because a year ago, a year and a half ago, there were so many mandates in place, at least in this part of the country, as far as what you could do and what you couldn't do. And we see so many of those mandates dropping away. If you were following the news at all, you just saw that New Jersey and Delaware are largely dropping their masking requirements. Should be I think, a little bit of a battle as to what happens to masking in schools. But in general, you're seeing the masking requirements go away. And if you're following what's going on in Europe, a lot of their restrictions in several countries are just dropping entirely. So what do you do when it's, now I get to pick as an employer as to what I want to do? Well, obviously, you want to follow what the CDC is saying. That stuff is guidance. But I think if you're following what the CDC is saying, you're going to be in good shape. I had a question, someone at the start of today's presentation typed in a question specifically to me. What do you think of if you're following CDC guidance and having everyone masking, but you let people who are alone in their office with the door closed not mask? I think that's, there's never a no risk proposition, but I think that's an extremely low risk proposition. And even at the height of masking requirements in Pennsylvania, Governor Wolf's mandates had said, if you're alone in an office, you don't need to wear a mask. So I think that's fine. I think you take a very, very minimal risk by doing that. But keep abreast of what's going on with the CDC, what's going on with state and local health departments. If you're in a city, if you have employees in Philadelphia, for example, your requirements are going to be a little bit different. They're a little bit more strict. Think about the written safety plan. And that's something that's, it's a living, breathing document that changes all the time. I recommended from the beginning that people not put those in their handbook because it's something you want to be able to go to every month or every other month and revise as necessary. But the things you're thinking about, what are we doing around social distancing? What are we doing around masking? What are we doing around vaccination and testing? And what is our protocol for either for positive tests or for people who've been exposed? Again, I'll probably stop talking about this next week unless or until there's a decision on the federal contractor mandate. But you all should know by now that the OSHA ETS was struck down by the Supreme Court and then subsequently withdrawn by OSHA. And I'll talk a little bit more about that in a second. The vaccine mandate for healthcare workers is in effect per a Supreme Court ruling. And like I said, we're still waiting to hear what the courts have to say about the federal contractor vaccine mandate. And just remember, these are just the federal vaccine mandates. There are different mandates going around on a more local level. There also really is the opportunity for a private employer to make their own decision in this space. And this is the statement from OSHA on withdrawing the ETS. I won't go ahead and read it. There is some suggestion here that OSHA might try to do something else or something more with this ETS. Stay tuned on that. It's not real clear especially if Omicron passes and we get into a better place, it's not real clear what, if anything, they will do. So what should you be thinking about? I've been saying this since vaccines came out. You are allowed to ask for proof of vaccination from your employees. You're allowed to ask them, are you vaccinated or are you not vaccinated? If they say no, don't ask why. That you potentially could get into some prohibited medical questions, questions that would be prohibited by the Americans with Disabilities Act. But yes, you absolutely can do that. And on the MEA community, that's our platform where members can go in and ask questions and have conversations with each other. There was a question this morning asking, can we ask if employees have had COVID in the past? Interesting question. So generally speaking, EEOC has told us that we can ask employees about symptoms. We can ask employees, have you had a positive test right now? Because that's a health and safety issue in the workplace, right? We want to monitor that so that we can tell people to stay home so that we don't spread. Asking an employee if they've had COVID in the past is a stickier question, I think. And again, this isn't a HIPAA issue. Employers, generally speaking, are not covered by HIPAA, but it is an ADA, Americans with Disabilities Act question that could be prohibited because long COVID we've seen, or effects from COVID, may be a disability. So I think you're taking risk as an employer by asking about past illness, whether it's COVID or something else. And the pushback I'm sure that I would get on that is, well, but we want to know if people have antibodies because there is some expression by the CDC that you're pretty good for 90 days after you have COVID. But at the same token, that's not a replacement for vaccines. So I would probably err on the side of not asking that question. Do you want to issue a vaccine mandate? And if you're going to issue the vaccine mandate, do you issue a booster mandate as well? I think the answer to that is probably yes. Why not get the most protection for your employees as possible? As far as the private employer vaccine mandates, those lawsuits are going in favor of employers. They're upholding the vaccine mandates. We just saw the mandate on the Philadelphia Police Department being upheld by a panel of arbitrators. So for the most part, if you have a good health and safety reason, and you're not the federal government at this point, your vaccine mandates are probably going to be upheld. Keep in mind that any policy is going to need to allow for religious or disability accommodation, or at least for the process of that. And if you have questions on that, talk to an employment attorney. Members, talk to Member Legal Services. We can talk you through that. If you're not going to mandate, encourage vaccination. I think we are a little bit back to carrots and sticks. Think about having a written vaccination policy, whether it's for mandatory or for voluntary. You just want your employees to know that you value the idea of vaccination, that you're trying to maintain a safe workplace. Again, this is part of your written safety policy that you can point to if anyone ever questions what you're doing about safety in the workplace. And part of that encouraging vaccination would be time off to get vaccinated and time off to recover from vaccination, paid time off preferably. And if you want to look for a guideline as to what that should be, the ETS, the now struck down ETS, said 4 hours to get vaccinated, 2 days to recover from symptoms. And I'm keeping these 2 slides in. I know we have slightly different audiences every week, but this is just so you have this information around the CDC guidance around isolation and quarantine. You can incorporate these guidances into your practices. What do you do if an employee has been exposed to COVID? What do you do if an employee has COVID? And keep in mind, you can always be more conservative than the CDC. Some of these CDC guidances are a little bit controversial because they are allowing people to sort of go out into the world, or saying it's okay to go out in the world maybe before some of us might be comfortable with that. So you can certainly say as an employer, and this is much easier to do if your employees can work from home, that, okay, you've had an exposure to COVID. I want you to stay home for a week and see what happens. Just stay at home, work from home. And let's see what happens. And then, of course, you monitor to see if anyone has developed symptoms. And obviously, the smaller of a business you are, the easier and more flexible that is. I think this would be complicated for a large employer for thousands of employees, but for most of our members, we're smaller organizations, and I think we can operate in a much more flexible way. All right, Kevin, any questions?
I think you addressed the first one that came in early.
Yep.
The only other question was, we do have a sample safety plan on the members site. So if you do want to take a look at that and you're a member, you can access that through the Help Center. And
we also have sample vaccine policies.
Great. I think that's it. Thank you all for joining us today. We look forward to seeing everyone next week, and take care.